All right. All right, so we all like to talk, obviously, and I'm not as comfortable standing up talking, but I do love talking about mental health. So that's when I love working with individuals and kids in particular. And so when I do therapy, when I worked in the hospital with kids with significant mental health issues, one of the things that we talked a lot about was learning how to talk about mental health. And the good thing is that you can learn the skills to take care of your own mental health. So there is that myth that people think you either have it or you don't, or it's predetermined. We're going to talk a little bit about the causes of mental health, but everyone can learn how to take care of their own mental health, even if you have a significant mental health disorder. But just because you have mental health problems or you're in crisis doesn't mean you have a mental health disorder. So you see the continuum up here, and it's really, really important to start the dialogue about mental health, and that's a really tough thing to talk about. So think money, sex, and mental health. Those are really tough things to talk about, right? And so one of the things that I always say to individuals in terms of understanding that is that we have mental health on a continuum, but it's not that much different than your physical health. So if you think about your mental health and your physical health, so I like to draw this because I want people to understand it and I want people to be able to relate to it. So not surprisingly, Dr. Carney talked about taking care of yourself in terms of your nutrition, taking care of yourself physically. And so your mental health and your physical health are really intertwined, and we are learning more and more about that all the time. The other piece is, are we always in a state of positive physical health? Are we always feeling great?
No.
No, so how many people here have a sore throat or a cold, right? And so we have to learn how to deal with those things. Same thing with mental health. There's lots of days when we don't feel our best, right? So we talk about stress or just mental health problems. And that's in the middle of that, right? Emotional problems or concerns. But the same thing here. We get the flu, right? We might have a broken leg. And so can we help it if we have a broken leg? If I go out there because I slip, because it's been freezing rain, is that my fault? No, right? It's not, I mean, I might have to, think about my footwear and those kinds of things, but accidents happen and we can develop physical health problems. It's not anyone's fault. And the same thing with mental health problems. And so really important to think about that and take away the negative connotations with that. This happens to all of us, and we all have to develop skills to look after ourselves. So when we think about our physical health, how many people regularly go to the doctor for a checkup, regularly go to the dentist for a checkup? We get our eyes checked. I see lots of people here with glasses, right? I couldn't work without my glasses. It wouldn't be very good. So we take care of that. But how many people here work on their mental health? I don't see any hands, but that's okay. So, well, actually, the fact that you're here means you're paying attention to it, right? And people want to know about mental health, and our kids want to know about mental health too, in a way that makes sense to them. So we're encouraging them to be mindful. We're encouraging them to have those conversations. So all the great resources that Chantal talked about are in our schools. And we want to watch about where we are in that continuum. And so we want to use the language. How are you feeling? Are you feeling a little down? I noticed last week you had more energy. And have those relationships. And what we're always striving for is moving this way on the continuum. So it's okay to have problems. It's okay to be in crisis as long as you work on getting back over here to this side of the continuum. And that's the same thing with our physical health. We're always working on that. And one of the ways that I like to do that with kids, so Chantal, you talked about becoming aware, about labeling, is I use either a 5 or a 10-point scale. So where 1 is feeling great and 5 is out of control. And so when we talk about our emotions, where are you today, right? Are you a 1, 2, 3, 4, or 5? And the idea, if this is like a thermometer, we always want to bring that feeling temperature down so that we can manage it. And that's exactly what Chantal was talking about when we acknowledge and when we flip our lid. We want to figure out, right, how we can get back to bringing our lid back down. And a big piece of that is the awareness of our feelings and being able to lower that temperature. And the way we do that is through the skills that we learn. And it looks different for everybody. And so we do a lot of work with our students around how we manage our stress. And it's never that we've got it all under control. We're always moving back and forth, and we always want to get back to the positive side of that continuum. And so that's what we want to do with our kids. And so we talk about mental health problems, and we also talk about mental health disorders. And many, as you can see, in terms of mental health problems, many individuals, many of our kids experience mental health problems. And that's really important to understand, because that doesn't mean that there's a disorder. And so we want to think about when we need to get help, when we want to teach skills. And so when we talk about universal strategies, it's talking about those skills. When it's talking about targeted specifically, so if you have a broken ankle, right, you might go to the physiotherapist. You might take some ibuprofen to lower the swelling, deal with the pain, use ice, those kinds of things. And we can do the same thing in terms of our mental health, learn how to deal with that. And so what we want to look for is when those mental health problems impact our relationships with each other. And for kids, it's when those mental health problems impact relationships with people at home, relationships with people at school, so teachers, friends, and if they're involved in outside activities, when there's an impact there. And that's when as soon as we start to see those things, we want to say, okay, what kinds of skills do we need to recognize and address those and bring that feeling temperature down? And so that can be anger, that can be excitability. Remember that whole chart that Dr. Carney showed you? Any of those things, even happiness. If you're experiencing too much happiness in the sense that it's overwhelming you can't think, right? If you think, well, I just won the lottery, that's great. Will I be able to go to work tomorrow? Probably not, right? So that's not going to be very good for me, right? I have to still be able to manage that. But if I'm angry, if I'm impulsive, if I really want to do something, like we've all seen our kids high up on that, and that's really great. So how can you bring that down a little bit so you can manage? And the earlier we start to teach our kids those skills, the better off they're going to be. So the earlier they learn how to bring that feeling temperature down, how to label those emotions, how to work through that, the better off they're going to be. And so typically we talk about two types or two groups of problems, internalizing and externalizing. Now the important thing is that the younger the youth, and we also talk about our kids with developmental disabilities, kids with cognitive impairments, they can also experience mental health issues, and it's really hard to figure that out. And so the younger the youth, the more difficult it is to tell what they're feeling and what they're going through. And it can be really tough to distinguish internalizing and externalizing, because kids tell us that something is wrong by getting our attention. And when kids are little, they do that by sometimes getting into trouble, by running around, by being physical. If you've ever spent any time on a kindergarten playground, you'll see, right? It's constantly about, okay, like how do we keep our hands to ourselves? Like how do we ask for that, use our words, right? Because they're not very cognitively sophisticated, right? And so if they've learned lots of times just by accident how to get the things that they need, they're going to keep doing it. So it's not because they're trying to hurt others. It's not because they're that's the way they feel. That's not about their personality. It's learned behavior. And what we need to do is teach them the skills to change that. And once kids develop language, it becomes easier for us to understand what they're going through. But when you think about little kids, right, they aren't very good at telling us what they need. And when you think about an infant, what you see is crying, right? And infants tell us that way that something is wrong. But how many of you have tried to figure out what's wrong with an infant, right? Or even a 1 or 2 year old, right? It's really hard to tell because the behavior is all over the place. But as individuals mature, they become more sophisticated, and we can tell what's going on. So internalizing problems are things like anxiety, depression, things that make a child seem quieter. And sometimes we overlook those kids because we don't have to pay attention to them. They're not causing us a lot of distress. And externalizing problems are defiance, aggression, those kinds of things. But they can overlap. So we tend to think of anxiety as an internalizing problem. But when someone's anxious and doesn't want to do something, what do you see? It can really look like defiance, right? There's no way you can make me do that, right? Likewise with anger. Anger, someone can also seem very quiet, but or they can be acting out, right? And so what we want to do is teach our kids to label those. And sometimes it's helpful to say, where are you on a scale of 1 to 5? 1 being calm and 5 being really out of control, ballistic. And let's see what we can do to bring that down. And then if we try some deep breathing, or can you just sit here and not talk for a few minutes? Where are you now on a scale of 1 to 5? Are you any lower? And that helps a child understand, yes, I can learn to do some things to bring my feeling temperature down. And it also gives you an opportunity then to see that strategy helps or doesn't help. So some kids have more than one mental health issue. And again, the younger the child, the more difficult it is to sort that apart. And so we don't want to diagnose kids very early on because it's too difficult to figure out what's happening. But when kids need help, and how do we know that they need help? It's because it's impairing their functioning. So they're having difficulty at school, and teachers are really great at being able to identify, because teachers work with kids. And you can say, in your classroom, is this something you see a lot of the kids doing, or is this something that looks a little different? And that can be helpful to you to understand. Or when we think about previous functioning. So 6 months ago, my child didn't have any difficulty with this, but now I'm seeing a lot more difficulty getting along with others, having difficulty sleeping, paying attention, getting along with friends. And that's when you start to think, is there a change here? So in Ontario, only regulated health professionals can provide a diagnosis, physicians and psychologists, so we want to be careful about that. We don't want to label. And again, we don't want to label very early on in terms of those mental health issues. What we want is to teach kids skills. And as you can see here, when we look at the onset, the majority, it becomes more evident, or we tend to diagnose those during adolescence. That doesn't mean that we don't want to recognize those things. And the earlier that we teach individual skills, we model those for kids, the less likely that they are going to be down at that end of the continuum. And even if they are, we know that if you do have a significant mental health problem or disorder, you can learn the skills to manage that and still do very well and be able to manage all the demands that life throws at you and be very happy as well. So again, going back to that analogy with physical health issues, right? So if you have a kidney problem, if you have diabetes, you can still live a very fulfilling life and be able to manage that as long as you have the skills. So it's the same thing. So as parents, we want to teach those skills. We want to model those skills. We want to talk about that. So what causes mental health problems? All of these things. There's not one thing that causes a mental health issue. So genetic influences. So we always ask about a family history. Neurological chemical imbalances, right? Again, that's not something that we necessarily have control over. That's the gift that we're given, so to speak, and we have to learn how to manage that. In most cases, we know that medication and therapy, in the case of chemical imbalances, are the most effective treatment, not just medication alone. So all of those lifestyle changes, along with what we call cognitive behavior therapy, is changing the way you think about that. So if you expect that life is always going to be terrific, are you going to be disappointed? Yes. But if you expect that there's going to be some challenges, then you're going to be able to think about, what do I need to do to manage those challenges? So I do a lot of work in the treatment of anxiety. And the one thing I never do is tell a child that there won't be something, that nothing bad will ever happen. Because do bad things happen? Yeah, they happen all the time, right? We watch the news, we all have setbacks in our daily lives. And the important thing is, how do you manage that? And so when we do work with kids, especially our high school students who are dealing with some pretty tough family situations, can you control it? If your parents are getting a divorce, can you control it? If you have a grandparent who is terminally ill. No, you don't have any control over that, right? So recognizing what you have control over and what you don't have control over. And when there are things that you don't have any control over, is how do you cope with that? How do you manage that? Because then we're preparing our kids for life, right? Because there will always be challenges. There will always be breakups with boyfriends and girlfriends. There will always be moves. There will always be challenging teachers and professors. There will always be fights with your friends, right? There will always be disappointments about the team that you didn't make or the art contest you didn't win or getting a poor grade. And how do you deal with that? And again, that can evoke a strong emotion. How do you bring that feeling temperature down? And how do you prepare yourself for that? And sometimes, how do you just tolerate that? So as Chantal said, it's okay to be angry. It's okay to be frustrated. And I know that as a parent, I hate to see my kids in distress. And my first instinct was always to jump in and fix everything. But I found I've learned over the years, it's much more effective to say, that really sucks if I can't identify the emotion right away. And what do you think you can do about it? Because I'm giving my child the message that I recognize they have a strong emotion and that they have the ability, I have confidence in them to generate solutions. And so then that starts the conversation. And that teaches them to be independent and teaches them to manage those skills. It's not always easy. Sometimes they come up with dumb ideas to deal with it and have to figure out, okay, punching them back, that's not such a great idea. Or dropping out of school, no, that's not such a good idea. But opening that dialogue, and so that because I come up with lots of dumb ideas that don't work and that are not palatable, and that would shut the whole conversation down. So I really have to restrain myself. No, we would never do that. So what we want is for our kids to generate those solutions. And so there's lots of environmental factors, and that's huge. The relationship that we have with each other, with our peers, academic issues. So all of those things can create stress. And you can have those three big ones, the genetic influences, the neurological chemical imbalances, brain trauma and other traumas, and be able to manage quite well. But when you throw in environmental influences, that can send us over the top, right? So we need to develop those skills in looking at the big picture and helping our kids to identify what's stressful for them and how that affects them and what they can do about it. Or if they can't change it, how do you tolerate it? Really important skill. When we think about what do we need to look for, people often ask that. So remember, the younger the child, the harder it is to tell, right? The more all over the place kids are. But what we can look for is changes from previous behavior. So if your child was previously really outgoing and engaged with his or her friends, but is becoming more withdrawn, then we might want to say, hey, what's going on? I noticed that, last month you were doing these things and this month you don't want to go. Doing things over and over again, so and a lot of that is sometimes a way to control. I know I'm an obsessive cleaner. So if I'm really stressed, I will either do a lot of baking or I'll do a lot of cleaning. And that's my way of trying to control my environment. And so sometimes that's what brings that out. Unstable mood, real ups and downs, emotionally reactive, extreme sadness. So that's when we start to think about, do we need to access support? Do we need to do a bit of research? And do we need to talk to our kids? And first of all, recognize, try to help them problem solve. What can they come up with? And if we're not seeing any movement there, then we need to reach out to professionals. But when we see those changes, and the school refusal is an interesting one because people ask me often, or ask us about school refusal. And the real question is why, what is behind that school refusal? It could be anxiety. It could be about marks and grades and things like that. It could be bullying. It could be feeling someone at home is ill and being worried about that, so wanting to stay home. So really, when we do assessment, when we do consultation, when we work with kids and parents, we ask a lot of questions. It's like being a detective. That's why this job is so much fun. We get to learn so many things, right? It's really about trying to understand the situation and what's going on in different areas and where the changes have been. So the most common mental health problems that we see in kids are anxiety, attention problems, and mood disorders. And all of those, they can have very similar overlapping symptoms, and we need to take the time to figure that out. And we need to talk to our kids, how can you bring that feeling temperature down and help them develop the skills? And if they can't, that's when we need to start to get some more professional help. So anxiety is normal, right? So when we think about the mental health piece, if you didn't have any anxiety, would you be motivated to do a lot of the things that you do? No, right? Every day would be like a Saturday morning, right? And so, or hopefully, you all get to experience some time without anxiety, and then you just look back and go, I didn't get a lot done, right? So, and that's great. So what we want to do is make sure that our anxiety energizes us and facilitates or pushes us to do the things that we need to do, but that it doesn't overwhelm us. So Chantal talked about fight, flight, or freeze. And so when we're very anxious, a very common reaction is just to get out of Dodge, to not want to do anything about it. So sometimes we'll see kids who are not doing their schoolwork, kids who don't want to go hang out with their friends. If there's social anxiety, they want to avoid all of that. The fight part might be, there's no way you're making me do this, or the irritability. What's wrong with you? You don't understand. Because they don't have the words and the skills yet to say, this makes me really stressed out, I don't know what to do, and understanding that. And that's part of what we do when we work with kids to help them become more aware. The freeze part is just doing nothing and just not knowing how to deal with that. And so again, we need to be able to help children lower that feeling temperature and figure out next steps, problem solve. So, and anxiety, I always say, keeps us alive. So when I'm with young children, I don't want them to run across the street. So it's my anxiety, right? It's adaptive. But too much anxiety, I say, robs people of opportunities. So if you have a fear of flying, you're going to turn down a job that involves a lot of travel. If you have social anxiety, which tends to peak during the teenage years, you might avoid parties and hanging out with your friends. And you're going to miss great opportunities. You're not going to want to go try out for new teams. You're not going to be able to meet people. And if that social anxiety continues, it might stop you from going off to college or university. It might stop you from hanging out with friends and meeting the love of your life. So really important that kids understand that. And sometimes we need to talk about that, how the anxiety is interfering and robbing them of opportunities before they're motivated to try and get treatment for that or try to develop some skills to deal with that. So with young kids, we see things like separation anxiety, so hanging around with strangers, very normal. As kids get older, up until about age 10 or so, we see more specific phobias like being afraid of the dark, being afraid of dogs, those kinds of things. And then when they get into the teenage years, we see an increase in social anxiety. And so social anxiety is very common. Now, we all have social anxiety. So getting up in front of a group of people and speaking, going for a job interview, right? That's all social anxiety, right? Being evaluated, worrying about your marks. Test anxiety, we often lump that in with social anxiety because it's about being evaluated. And so there's nothing wrong with that. And that's really important too, to help our kids to understand we all have some anxiety. We all experience social anxiety. But when it interferes with our ability to do things or want to try things, that's when it's a problem. And a lot of teens are surprised. And that's why I really like doing group work. So working with kids who have significant issues with anxiety, when you get them together, it's really interesting because when everyone starts to talk about what makes them anxious, you see that big sigh of relief. Oh, it's not just me. I thought I was the only one who was concerned about that. And then we talk about how to recognize that and strategies to deal with that. Same thing with inattention, hyperactivity. We can learn impulsivity. We can learn how to curb that by talking about, when is too much energy? How do you bring that feeling temperature down? How do you down-regulate? And we all have those problems sometimes. We all have ants in our pants. And so how do we do that? Do I go for a run? Do I need more sleep? We also know that sleep is huge. So for kids who are sleep deprived, it can often look like ADHD, impulsivity, attention issues. So again, there's that crossover between our physical health and our mental health. We need those kinds of things. When kids don't have proper nutrition, we see some of those symptoms. And by helping kids learn about that, and there's the same thing as with anxiety. How can you bring that down? What strategies work for you? Is it a fidget? Is it about learning to think before we do something? You did a really good job acknowledging that when you see someone go, I want to do that, but they are able to control themselves, so that we teach our kids that we see those kinds of things. So anxiety is one of the more common disorders, both in kids and in adults, and it's often related or linked in with depression. So when we feel a lot of anxiety, we feel nervous, we feel stressed out all the time, we're unwilling to do things, and then we don't do things, and we think, I'm always going to feel this way, nothing is going to help. Those are symptoms of depression. So we get into that negative cycle. And again, we can have significant symptoms, or we can have a disorder. And the idea behind learning the skills is that we can stay out of that disorder range where it's impacting our functioning, so that we can learn the skills to deal with it and recognize it. But think about when you have anxiety. It impacts your ability to think clearly, ability to problem solve, ability to focus on your work, to concentrate. So it's always a really important consideration when we think about what's causing stress for our kids, why they're not functioning the way that they did previously. Common anxiety disorders, I'm not going to go through all of them, but the main point is that the younger the child, the more diffuse, the more we can see a range of behaviors. And as kids get older, it tends to be they're able to articulate it, or they're becoming more clear. Because kids also have more control over their lives, right? So when you're 4 or 5 years old, or even when you're 7 or 8, can typically, if you don't want to go to school, and there's nothing wrong with you, your parents will say, get in the car and let's go to school, right? Kids don't have so much control. But when kids get older, when they get to high school, that's when they have more control, and then we see sleeping in, avoiding school, staying home, leaving school early, or they can be very convincing in telling you that they have a stomach ache, that they can't do something. So important things to look for. So in terms of anxiety, 6 in 10 youth report having high levels of anxiety, and I see a lot of those kids. And a quarter of parents have told us that they have missed work or other obligations to support their child with anxiety. And it's really tough. So I have personally had the experience of trying to get a kid to camp who does not want to go to camp, who was very anxious about going to camp, and it took all day to get him to camp. Yeah. and once he got to camp, he realized that he could get through it. And so it was really tough. And one of the things that we want to do is let kids know that we have confidence in their ability to develop the skills and manage that situation that makes them anxious. So if you're worried about a test, then we go through all those things. I studied, I got this, I prepared for it, I can do this. Rather than saying, okay, well, let's talk and maybe you can do it next week. So we want to give them that message. And that's called exposure. So in our business, we call that exposure therapy, is making sure that we support our kids to do the things that they need to do rather than letting them avoid it. Because what happens is when we let them avoid it, they learn that avoidance brings down that feeling temperature, and that's the strategy that they're going to use. So if you have social anxiety and you don't want to go to a party with your friend or your best friend's birthday party, then you're going to learn that avoiding that party brings down your feeling temperature. And what we want to do is teach kids that when I practice my deep breathing, when I go with a friend, once I'm there, I know I can do it, and I can manage my anxiety. I can learn to manage my anxiety rather than letting my anxiety manage me. So I talked a little bit about those strategies. Attention, hyperactivity, so sitting still, paying attention. And one of the things that I always say is no one's at their best when they're halted. Hungry, angry, lonely, tired, and I include bored in that. So Chantal alluded to being hangry, but there are a whole range of things that can result in hyperactivity or impulsivity. We always have to think about that. We want to try those frontline strategies. Enough sleep, lots of exercise, making sure we get enough to eat, and then teaching how to downregulate, recognize how you can bring down your hyperactivity, your impulsivity, what strategies you can use. Because kids mature at different ages. So when you get a group of 6-year-olds in the room, they look very different. Some of those 6-year-olds are sitting quietly, and some of those 6-year-olds need to be running around the room. And all of that is perfectly normal. It's when that's interfering with their social relationships, with their ability to learn, that it becomes a problem. And so school requires all of these things, sitting still, paying attention, all the things we're doing here. But think about it, it's pretty warm in here, right? And how many people are thinking about, oh, it's so hot in here, I can't wait to get out of here, and I know like they're going overtime, so are you able to concentrate? No, and so we want to help our kids manage those distractions, recognize them, and what's causing stress for them. And again, those are the first things that we do. How many people here check their phone and still can still listen to a talk or pay attention? Absolutely, right? Now we did talk about mindfulness, but sometimes when you need to do those things, when I do presentations with adults, sometimes we will leave fidgets on the table. So lots of people like to doodle, lots of people like to play with paper clips or twist ties, things like that to help them focus. Some people like to hold a pen, some people like to have something to drink. So as adult learners, we do those things, and we're trying to get better at accommodating our students as well, in terms of allowing them to do some of those things that are appropriate, don't interfere with others' well-being, to help them manage their attention. And the more kids learn about that, the more independence they have in managing them. I like to fold laundry while I watch TV. It reduces my anxiety and reduces my fidgetiness. So these are things that, for students who have an individual education plan, they may have on their individual education plan. These are things that teachers will often talk about. We talk about even doing some of this at home, a structured, predictable environment. Doing a little bit of work. I like to say, let's look at the clock. When the big hand reaches the 1 or the 2, then we can stop and take a break. And then we do a little bit more, breaking it up into chunks. So those are strategies that we often talk about with parents that we try to do first before we think about disorders or making more significant changes. Mood problems, so anxiety and depression are lumped in under mood problems. And again, think about it. All of us have times when we're feeling down or stressed, and so do our kids. And so we want to help them recognize that and think about, what can you do to get yourself out of your funk? Can you call somebody? Can you listen to some music? What about taking the dog for a walk? What about going out? What about cuddling up on the couch and watching a movie if tonight's not a great night to do something like homework? Say you didn't sleep well. So those are strategies that we want to teach our kids first, and we want to model them so that we are showing them that it happens to us too. Symptoms of depression, low mood, sadness. And so these are all changes from baseline. So changes in a lack of interest in something that they previously enjoyed. So it's hard to tell with kids. Sometimes they grow out of an activity. Sometimes it's there is something else going on. Crankiness, so with irritability, often a sign of depression. It's not just feeling really sad and low, or that low energy. So some signs and symptoms in teens, so can look very differently in young kids versus older kids. And these are the kinds of things that we want to look for. And the risk factors, ongoing stress. We know that kids with learning issues or developmental issues are at higher risk for developing mental health issues. Chronic illness, so individuals who are also coping with another significant stressor, such as a chronic illness, that can also be a risk factor for a mental health issue. Trauma, so that's why we keep an eye on kids who have, say, experienced disasters, accidents, have been involved in a critical incident at a school. And family history. So we might not think about that, but if you think about if we're not involved with your child, but if you know yourself that you've experienced that, you think, maybe there's a genetic component there, and we want to educate ourselves about that. And it's never too early to educate your child about some of those things and things to think about. Depression management, so seeking supports, building opportunities to succeed, whatever that may be, listening, caring. So some of the things that we talked about, those are all first-line defenses that we want to introduce. The Ministry of Education has a great document, Supporting Minds, and you can access that online as well. That talks about what that looks like in the classroom, what we can do in the classroom, and how to talk about that. So, I don't know if you want to recap, or okay, if anyone wants to jump in. So, when we talk about positive mental health, it's never that we're there and we're stuck there and that, you either have it or you don't. It's not like that at all. We all move back and forth along this continuum depending what's going on in our life. And we have a lot of control over that by thinking about our relationships, our responsibility, and our resiliency. So, and the relationship piece is key. And sometimes we don't have the energy to go out and do things, and sometimes it's really important then to pick up the phone or then to go out and walk or engage. And once you start doing so we talk a lot about behavioral activation. So once you start doing some of these things, you start to feel a lot better. Thinking about the relationship between fitness, spirituality, and how that impacts our mental health, and they're very much intertwined. I encourage you to look up those hand models of the brain. YouTube is awesome. I don't know what we did before, but you can just learn so many things. Validation, and keep in mind we can all learn the skills, and the fact that you're here is tremendous. We're actually overwhelmed with the number of people who are here, so this is fantastic. And the more that we talk about mental health, if you go home and you say to your kids, I went to a talk on mental health, it was really interesting, right? You're modeling for them. That is something that you do to look after yourself and look after the people who you care for. So that's really important.